welcome. I'm Nancy Seaver at Mind Alive, and with me today I have Marianne Januski and Jackie Kilraine, and we're here just to talk a little bit about how Jackie uses AVE in her practice. So like I say, we get lots of reports from clinicians telling us how great all of this is, and we just invited you to come and share some of your stories. So maybe you can just tell us a little bit about your practice and how you use AVE.
Okay, sure. I am a doctor of chiropractic by trade, and I've been in practice a long time, 33 years. And I treat, most of my patients are women with chronic pain. And I started with chronic pain, many years ago. My very first fibromyalgia patient came in, and I adjusted her like everybody else. And I said, "Do you feel better?" And she's like, "No, as a matter of fact, I think I feel worse." And I was like, "Oh, something different going on here." So my whole practice really revolved around trying to figure out that chronic pain patient. And I started several years ago doing neurofeedback in my practice, and realized that most of the chronic pain was centered in the brain. And when we started treating the brain and including the brain in the practice, our patients just started getting a lot better. So we started doing the AVE really more intensely recently. And that has just made such a difference in patients. Not everybody was doing neurofeedback. So when we started adding the AVE, I had a patient last week, this was just last week, and it was just the other day, but I'd seen her last week, and she came in and she said, "When I was here last time, what did you do?" And I was like, what do you mean, what did I do? Because I didn't really know what she was going to say. She said, "I have felt so amazing after that." And we just did the coffee break one, the 15-minute session when she was on some other therapy, and she just felt so much better. She was telling her girlfriend up in New York, and I'm down in Georgia, quite a ways away, and just felt so much better. Another patient I had multiple surgeries. She just comes in to get massage, and I said, let me just do this on you today. And this was today, and she felt so much better. And that was just with a short, one session. That was just one session. So we do it a lot. We just know that really can't affect chronic pain without treating the brain too. So when we started adding this, it's just made such a big difference. Many of them, especially during this whole pandemic too, so many of our clients are, just that extra stress and that extra layer of trauma has just turned the volume up on their pain. And, we get it. We know that we need to do something just to kind of calm that nervous system down. And this has been so simple for them, so effective. Love it.
Have you tried the cranio-electro stimulation along with the AVE?
I have. Yeah, I have. With cranial, I do the one with, you mean that? Yes. I do. We do that too. We definitely do that. Yeah. Love it. Yeah, it's been terrific, actually. And sometimes we'll do a map and we kind of look at the map. So we may just do a map, and maybe they're not doing other training, but we'll match their AVE training with what we kind of see on their map. So that seems to be real effective for them. Yeah, it helps a lot. They love it. They definitely love it, because most of the time, by the time they've come to my clinic, they have seen multiple practitioners. They've been on multiple medications. Some of them had multiple surgeries, and those just... And even me, I felt like for the longest time when I was treating patients, I was kind of putting a Band-Aid on it. Maybe it wasn't giving them medication, like they may have had failed somewhere else, but I was still doing a lot of body work that was still just putting a Band-Aid on it. It really wasn't getting to the real root of the issue with their pain, which was their brain. So, now we understand that, and we're getting a lot better results.
And it's nice when they're on other medication not to have to add pain medication.
Oh yeah, right. Yeah, that's not something I do in my practice, but then when you can step back and you look at the whole system. So, I was approaching people through my training, which was more body work and, musculoskeletal, and that was all really helpful, but we weren't looking at how it was affecting the whole system. So I get them to understand or to see that you know, maybe their guts shut down because their brain's so overactive that they're running for their lives. They don't need to digest food, you know. So when we kind of get their brain calmed down and their nervous system calmed down, then everything else starts to fall into place and function better. And it's so helpful for them to know, I don't have multiple things wrong with me. I don't have to go to a doctor for my gut, and I don't have to go to someone else for my depression and my anxiety. You know, when we're, and I don't need to come to the chiropractor for the chronic pain and go get a massage for this and go get medication for that. If I can just kind of step back and treat the whole system and include the brain with it, which is the main controller of everything, then everything starts to fall into place. And I just start to heal as a whole system versus a gut, a back, you know, a brain, you know, just kind of putting it all together. It really helps them put it all together. I think it empowers them a lot too. They just see, you know, I can do this. I could take this. I could do this at home. I could do, you know, I understand why I'm doing what I'm doing now. And my whole body's kind of falling apart. And I'd always look to it. Lots of the patients we see have autoimmune issues. And that's because they weren't, you know, the body just kind of starts to attack itself. But, you know, we weren't really addressing I don't know why we're always addressing from here down. I don't think we were taught to do from here up too well. So
Sure.
it was, you know, it was taboo, I think, or for, you know, we just weren't supposed to. I don't know. I always wonder that now. Yeah.
Yeah.
Mm-hmm.
Well, do you have any favorite sessions that are your go-tos, or do you use different sessions?
We use different sessions, but we use a lot of the meditative kind of calming sessions. We use I like to use if I'm not treating them symptomatically, I like to use the gamma too. I just think it's a good, you know, focusing preventative, you know, we know that it just some science behind how well that's healing for the brain. And so I like to do that on myself. And I kind of take them through a little bit of a progression too. We may be treating more symptoms in the beginning and just trying to calm your system down. And then we may be, you know, let's have a little more fun with it and use it for more focused things. You know, like maybe doing the gamma just to kind of help with our brain health overall, or, you know, maybe we need to get up and focus and study, or we need to, you know, do something for purpose, you know, more purposeful, more than just trying to treat a condition. So I think they kind of like to see how we could use it different ways, you know, what their goals are. It's kind of fun when you get out of the sick phase, and then you can kind of get into the, you know, the optimization part of it.
Right. Yeah, just being better, right? Doing
Yeah. You know, we really, I think that's exciting. That's exciting, especially because a lot of the people I treat have been sick for a long time, that we have to try to get them to reimagine being in a different place. So we actually have them do that, you know. Where would you like to be? Imagine your perfect day. You know, we kind of help to use some of the different trainings to help them achieve some of the goals. And then go back and, you know, they've had so much anxiety and depression with their chronic pain that once they kind of break free from that, then they go back to school, or they'll go do a new career, or they'll get up and, you know, make that speech, or, you know, it's just going to be life-changing. So it's kind of a progression depending on where they're at, and we kind of move them through with the Mind Alive, or with their other treatment to other goals.
Well, how exciting.
Yeah, it's fun. It's a lot of fun. I love it.
It is.
Yeah.
Well, I just want to thank you for joining us and sharing some of your experiences and stories. Like I say, we get feedback from clinicians, and I just love, you know, hearing the story. Marianne and I just started this project just to, you know, be able to meet people and, you know, just get some ideas to share, you know, with others. So I just want to say thank you so much for being with us here this evening.
Well, thank you so much for having what you do and letting us all use it. And I'm very grateful. My patients are very grateful too. I'm very appreciative of what all y'all do, for sure.
That's wonderful. Yeah.
Good to hear.
Well, thanks so much.
Okay. Thank y'all.
Thank you.